Hi, and welcome to another episode of Young at Heart. I'm Tammy Murray, and I'm here today with Judy Labossiere. She's the COO at Norwell, VNA, and Hospice. Hi, Judy. How are you?
Good. How are you?
I'm good, thanks. I'm really glad you can make it. I love, we'll get to it later, but I love the fact that you guys actually have a house for hospice patients on the South Shore. And that's really near and dear to my heart, so it's something I really want to jump into. But before we do that, how about a little bit about yourself, your background, how you got into the industry?
Thank you, Tammy. I want to thank you for having us. I am a registered nurse by background. I've been a nurse for quite a while. I started out many years ago in ICU, CCU, ER nursing, but my passion all of my career, and even when I was in school, my passion was always home care. And I wanted to go right from school into home care, but my husband at the time said, no, I'd rather you go into a controlled hospital setting. So I did, spent 10 years in the acute care arena, and then pursued my passion of going into home care. And I've been in home care ever since, which is about 28, wow. 30 years now. And I have really seen a lot in the home care arena. I've run many different kinds of organizations, but recently coming to Norwell VNA, I feel at home.
That's wonderful. Do you have, sorry, the history of Norwell VNA?
So Norwell VNA started back in 1920, serving the town of Norwell, where there was one nurse and a doctor. They ran a lot of the school health. They took care of the residents of Norwell. Over the years, it expanded as the residents expanded in Norwell and grew through many towns. We now have come to serve 27 towns on the South Shore communities, and we service them through multiple programs. So over many, many years it's grown, but it's always remained true to its roots, and that's serving the needs of healthcare in the community.
And you recently, again, won an award. Is it the Home Care Elite?
Home Care
Award?
Elite, yes.
Yep. Congratulations.
Thank you. We won the Home Care Elite for the 9th year in a row. It is the top 25% of home care companies in the nation. We made the top 100, so we are the top 100 in the nation.
That's wonderful.
Yes, we're proud. Thank you.
And just to kind of circle back to a show that I had previously, we were talking about in-home private pay home care. And it was brought to my attention and a lot of the viewers' attentions that not every home care agency is created equal, and that there are some differences in how you run your home care agency versus someone who applies for a license and then is all right in the state to go out and do home care. Mm-hmm. Can you talk a little bit about what your process is as far as background checks on people that work for your company and how you keep on top of them?
So NVNA Works is our private duty component. It is an arm of the NVNA Foundation, and it is where we do all of our private duty care, so that if somebody needs help in the home, their loved one needs just a little extra assistance to stay safely in the home, we have the staff that can go out. They can go out for companionship, they can do shopping, they can actually do some hands-on care. Mm-hmm. And all of our employees come through our agency, and we look to the same things through for all of our employees. So we do query checks, we do reference checks, we make sure that we talk to people where they've been employed before. They have to maintain in-service hours. Mm-hmm. We hold them to the same standards that our certified employees are held to.
And that's good to know. So I guess I just want to reiterate to everyone who's watching that when you are looking for a home care agency, make sure you do your own background research on the company that you're having into your home or over to take care of your parents or grandparents. So thank you for explaining that.
You're welcome.
I find it so important now. So as far as services, you mentioned the private pay, private duty, where you can do shopping or light housekeeping, companionship, that kind of thing.
Hands-on
What
care.
other services does Norwell VNA and Hospice offer?
Well, we have our base traditional Medicare, Medicaid certified home health agency where we provide nursing, rehabilitation, that's therapies, social work, home health aides, and this falls under the federally government federal program of Medicare and Medicaid, and commercial insurances and HMOs, and you have to have a skilled need. So it's oftentimes after you've had a hospitalization. For instance, if you've gone in and you've had a knee replacement and you come out and you have to have therapy, some nursing, that's the certified side of our business. Okay. And we have nurses, therapists, and social work, nutrition, home health aides, that would care for you in your home following that acute
And that could last
episode.
anywhere from 1 day to months, as long as it's approved by your insurance. And if it wasn't, then you would move on to the private pay.
Right,
Correct.
or you meet the conditions of participation as deemed under Medicare certification.
Okay, that's good to know. I think sometimes people get confused as to whether it's covered by insurance or not covered by insurance, and what to do if your insurance decides they don't want to pay for it anymore. So I did want to highlight that you can pay out of pocket at any point for any of these types of services for the most part. Is that true?
Well, you wouldn't necessarily need to. Most of the insurances, or if you are Medicare, if you have Medicare or Medicare eligible, they would be covered. Most insurances cover the certified piece.
Okay.
You would pay, if you were going to pay, it would be most likely for the private pay services.
Okay, great. Thank you.
You're welcome.
Okay, now we can jump into the palliative care and the hospice care that you're providing. Hospice has been with Norwell VNA for
5-6 years.
5 or 6 years now. Can you explain a little bit about what the palliative care piece of that looks like?
So our palliative care program is a piece of our certified side. Our patients reside under our certified side. They are not on our hospice program. So it's almost the segue of our patients that require some significant symptom management. They have probably chronic disease processes going on. They may have significant pain. They may have multiple chronic processes that require a lot of symptom management, and they are at the point where they still want to receive treatment. They may want to have chemotherapy if they have a disease process that requires chemotherapy. And this part of our program is run by a nurse practitioner. So we have a palliative care, a certified palliative care nurse practitioner, and she manages a team of nurses that really work together with her on managing those acute symptoms and helping a patient segue from the certified component of their care, move through the continuum, and eventually may or may not require hospice services. A lot of our patients on our palliative care program do move seamlessly through to hospice.
Okay. And I know with some palliative care patients, they could stay on for years and years. You know, so I guess I'd like to get out there sometimes that hospice is misunderstood or palliative care is misunderstood, and it doesn't mean that just because you're receiving this service that it's, if you're a palliative care patient, that it's going to absolutely leave to hospice within a month or a year, but that people can stay on those kinds of programs for a while. I think a lot of people are afraid when they hear palliative care or hospice, and that's why I'm just kind of throwing it out there that that can happen. I've also known people who've been on hospice and then been off of hospice and back onto hospice. And does that, have you seen that happen with your industry, or that people misunderstand what the hospice program is?
I think people sometimes do not understand the full component of what hospice can provide. Hospice, there has to be a eligibility, there's an eligibility requirement that the doctor, the physician, deems that the patient has a 6-month or less trajectory to live if the disease progresses as it should. And so the doctor deems a patient eligible for hospice. But I want to stress that hospice is helping a person go through the end of life. And I often say that hospice is really about living life with the best of quality when you are faced with the end of life. So hospice can help people live the rest of their days to the fullest, and their families to help the patient go through end of life with the best of quality.
Yeah. I should mention, and I probably didn't before, I do some volunteer work for a hospice in the area doing complementary health care, so Reiki and things like that. Do you have that available at your place as well?
Yes, we do.
That's wonderful. It's amazing to work with families that are going through such a hard time. So do you have support systems for the family as well? Do you offer respite?
Yes,
like that?
We offer great support services through our bereavement counselor, and we have social work. So we have a social worker in our hospice side. We have our bereavement coordinator. We have chaplain. So we have multiple abilities to help patients and their families go through the process.
That's wonderful. I think the most exciting part of talking about hospice with you is that you actually have a hospice house. And I only know of one other that's within 20 or 30 miles from here. So I wanted to talk about that a little bit. It's called the Pat Roach Hospice Home.
Yes.
And it's located in Hingham, correct?
Turkey Hill.
Turkey Hill. What type of person, or what brings a person to live in a home rather than to be at home?
Well, I think there are multiple reasons that a person might choose the hospice home over being in their home. And again, it comes down to a personal choice. But we see patients at the hospice home that may not be able to take care of themselves because they may be alone. And facing the end of life, they may not be able to do that without a support system. So the hospice home would be a great choice because they have a support system there. We see, and I've been surprised, and I think Meg Doherty, our CEO, has also been surprised by the fact that in our hospice home, we have seen many young people come through, younger people come through that may not want to have the end of their life in their home with siblings or young children there, or they want to separate themselves out of the home at the end of life, especially if there's young children.
Right, yeah, absolutely. Could you tell me more about the house? I'm assuming it's staffed 24 hours a day. It's a nursing facility type setup?
It's a home.
Yeah.
But we do staff it 24 hours a day. We have LPNs and home health aides 24 hours every single day of the year. But basically, I'd like to stress that it is a home, and we want it to be like a person's home. We have kitchens for families. We have a whole family room downstairs where families can come in and enjoy time together with the resident that's the patient that's there, or themselves, and just have a place to go for quiet. We have a large living room, a tea room. We have beautiful land there, a lovely porch where people can go out and sit when the weather is nice. Every room has its own private bath, TV, phone, and we stress that this is a home to people. We want people to be able to come in there and feel serene, at peace. There are family rooms there that if a family member would like to stay over coming from out of town, or even if they just want to stay over, we have 2 suites for families.
Oh, that's
can stay.
fantastic. That's really nice.
It's beautiful.
I did see pictures, and I believe people will be seeing pictures as we discuss this, but it's beautiful. It's something that I noticed was, you assume that when you go into a home like this that it would be single rooms. But in a skilled nursing facility, you'll see 2, 3 beds in a room. So this is all private.
rooms.
Yep, it's your room. You do with it what you wish while you're there. It sounds beautiful.
Speaking of, we have in the house we have a salon that we have the ability to have people have their hair done. They can have nails done. They have can have massage.
Yeah.
We have a massage table. So we want it to be a place that people are at peace and get the best of care at the end of their life.
That's fantastic.
12 beds.
Oh, yeah.
There are 12. There are 12 rooms.
12 rooms, and then
Yeah,
you
right
have
now,
the
12.
suites for the families as well.
And then with the suites for
wow.
the family. Right now we have 12. We can go eventually up to 15. We have 12. And as I said, every room's private. Every room has their own full bath, with a shower that people can just wheel right in. And TV, phone. There's a recliner in the room so that if a family member does not want to leave the patient's side, that family member could sit there and recline and be comfortable as well.
That's wonderful. I think it must be a relief to the families in that they're not made to feel like you have to leave when visiting hours are over, or, it's really, here is where you can be until you don't need to be there type of.
We have people coming in day and night, all hours of the day and night.
Yeah.
People are welcome. The facility is, at nighttime we have it alarmed so that people are just not walking in the doors, and we have a very secure environment, but we welcome any family member at any time.
That's wonderful. The other piece that I wanted to talk about was the cancer support groups that you offer.
Yes. So we have a cancer support community that is part of NVNA and Hospice, and they offer many support groups and programs that help people deal with cancer, and it's either the person going through it themselves or the caregiver, family member that needs a support group. So we offer a number of multitude of programs. We are just also starting a children's program where we're offering a program for children that may be faced with a parent or a grandparent that is facing cancer. So we deal with people of all ages now within the cancer support community.
Which is wonderful. And I find lately at our center there have been a lot of people that have had health issues, and personally I've known a lot of people going through struggles, some with cancer, some with other things. And it seems that reaching out for that support is easier now for them. It seems not to be something that makes them feel weak. And like I told someone that I was talking to yesterday who recently had a stroke, sure, go to the support group, and if you don't like it, you don't have to stay in the support group, but at least know that it's there and that you can use it for as long as you want. I have a friend who's going through a breast cancer treatment right now, and her husband has been so completely supportive. And when I spoke to her about it, they're both going to support groups to help each one. So he goes for husbands that have wives with breast cancer, and she's going to a breast cancer support group. And it just seems to add so much to the fight that when you're getting chemo and those kinds of things, that those are available. So I think that's awesome that you guys offer that.
Well, the cancer support community, it deals with support groups for the patient going through the cancer diagnosis, any cancer diagnosis. We have the breast cancer support groups, or the caregiver that is supporting that person, and there's no charge for these groups. So we have a yoga session, we have art therapy sessions, and so there's a wide variety of programs offered down in the cancer support community. But I also want to note that we do, through NVNA and Hospice, have support groups that we provide to the community. We have an Alzheimer's support group. We have a brain aneurysm support group. We have a Matter of Balance program. We have an awful lot of programming through also our certified side. So we've tried to provide to the community a full range of services.
That's wonderful. Things that I haven't hit here, are there things that you would like to discuss or to highlight about your company and the products, or it's something you want to get out as your message, anything like that?
Well, I feel passionate about home care. As I said earlier when I first came in, home care has always been where I felt that probably people want to be cared for. Most people would rather, I think, stay at home or a home-like setting, as our hospice home is, and receive the care with their loved ones around them, have a say in the plan of care and developing that plan of care, and be in their home and be at the place that they have known all their lives and feel comfortable. So I feel passionate about the delivery of care through home health. We at Norwell VNA are community driven. Our mission is one of serving our community. Everything we do has been to support and assist those neighbors of ours in the communities that we serve to remain in their home and to get the best possible quality of care. And so I'd like to let everybody in the audience know that I think where we have moved over the years is to provide a continuum of care so that at any point in your healthcare need, you can come to Norwell VNA and Hospice, and we can provide the care that you would need. So we, through our programming, through our private services, through our hospice home, through our palliative care, through our certified services, to our cancer support community. And our outreach, we do a lot of community wellness. We're starting to do a lot of wellness programs in the community where we are looking to help people before they reach the need to have services in the home. We want to keep people healthy, and we feel strongly about providing that continuum of care so that we touch people at many points in their lives. And you can become part of our family, and we'll become a part of yours, and we'll be with you for a long time.
No, and that is a good point too, that the community outreach is so big. I mean, I know we've had programs at our center where people come in and they talk about, how healthy eating or stress or things like that, that kind of get people comfortable with what you're offering for later on. So when they decide that they might need a company to come into their home, they know who to call, and they know who they trust. I find I've been working in a skilled nursing facility for a little while, and I've noticed that a lot of people, and actually my own mom, when she had her knee replaced, isn't interested in being in a skilled nursing facility at all. So the first minute they get, they're signing themselves out. And it's great to see, as a child of someone who went through it, that the progression of in-home care. I remember where it was like, they could come over and check your blood sugar or take your weight, your blood pressure, and then go home, where now they can do so much more when they come to the home and visit with a patient.
Well, it's interesting that you say that. And I also want to, before I talk to the point that you just made, I'd also like to say that we have an office down in Pine Hills in Plymouth where a lot of our wellness, we're going to be doing a lot of wellness programs out of that office and community outreach programs. So we, again, find that we're becoming more enmeshed in providing wellness programs, and we're trying to do that throughout our service area. But it's interesting, I want to get back to the point that you made about home care evolving over the years. Back when I first started in home care, I'm not going to tell you how many years ago that was, but we did do just blood pressure, and we would go in after a long hospital stay, and we would do just a couple of days of home care. Now we take care of very complicated needs in the home, and provide IV therapy, provide complicated wound care. So the venue of home care has changed.
Yeah, as well as the social work and the physical therapy and
Correct.
occupational therapies that can come into your house. So you almost get exactly the same as you would in a skilled nursing facility.
You don't stay in the hospital very long. You don't stay anywhere very long. You come home, and that's when we step in and hope take care of you and bring you back to your best possible state and discharge you to your community again.
We're going to be running out of time, but I did just want to touch on one other thing. If somebody isn't sure that their parent needs somebody at home with them, whether it be for private pay or for certified care, they can still call and go through a screening process at your company, correct?
Most definitely.
Okay.
Anybody, anywhere can call us. We will connect you to the party that you need to speak to for the service that you need, and we will be glad to walk anybody through, answer anybody's questions, and help you make the right choice.
Great, thank you so much. I really appreciate you coming on the show today.
Thank you, Tim.
And to everyone else, thanks for joining us, and have a great day.